Hello and welcome. Today we're diving into the world of neurological disorders to explore Angelman syndrome. This rare genetic condition affects the nervous system, leading to developmental delays and a unique set of characteristics. Join us as we unravel the complexities of Angelman syndrome, from its causes to its management. Angelman syndrome arises from a problem with the UBE3A gene located on chromosome 15. In most cases, it's not inherited in the traditional sense. Instead, it typically occurs due to a spontaneous genetic mutation during the formation of the egg or sperm cell. Less commonly, it's caused by inheriting two copies of chromosome 15 from the father, instead of one from each parent, a phenomenon known as uniparental disomy. A small percentage of cases are due to a deletion on chromosome 15 where the UBE3A gene is located, or by a mutation in the UBE3A gene itself. The UBE3A gene plays a crucial role in the brain's function. It provides instructions for making a protein called E3 ubiquitin ligase, which helps regulate the breakdown of other proteins. Typically, individuals inherit one working copy of the UBE3A gene from each parent. However, in certain brain regions, only the mother's copy is active. When the maternal copy of UBE3A is missing or mutated, the brain doesn't produce enough of the necessary protein. This deficiency disrupts normal brain development and function, leading to the characteristic features of Angelman syndrome. Angelman syndrome is considered a rare disorder, affecting an estimated 1 in 12,000 to 1 in 20,000 live births worldwide. It affects individuals of all races and ethnicities equally. Because it's often the result of a spontaneous genetic mutation, it doesn't typically run in families, making it difficult to predict or prevent. The signs and symptoms of Angelman syndrome can vary, but some are more common than others. A hallmark characteristic is developmental delay, noticeable by around 6 to 12 months of age. Other common features include intellectual disability, speech impairment or absence, movement and balance problems like ataxia resulting in a jerky gait, and a happy, excitable demeanor often accompanied by frequent smiling and laughter. Seizures are also common, often starting in early childhood. Many individuals also have sleep disturbances, a small head size called microcephaly, fair skin and hair, and a fascination with water. Diagnosis typically involves a combination of clinical evaluation and genetic testing. Doctors look for the characteristic signs and symptoms. If Angelman syndrome is suspected, genetic testing is performed to confirm the diagnosis. This usually involves a DNA methylation test to look for abnormalities on chromosome 15, followed by more specific tests like UBE3A sequencing if the methylation test is normal but suspicion remains high. These tests can identify the specific genetic cause of the syndrome, whether it's a deletion mutation or uniparental disomy. While Angelman syndrome doesn't have distinct subtypes based on symptoms, the underlying genetic cause can sometimes influence the severity of the condition. For example, individuals with a deletion on chromosome 15 may exhibit more pronounced symptoms compared to those with a UBE3A mutation. However, regardless of the genetic cause, the core features of Angelman syndrome remain consistent. Currently, there's no cure for Angelman syndrome, so treatment focuses on managing the symptoms and improving the individual's quality of life. This often involves a multidisciplinary approach with physical therapy to improve motor skills and coordination, speech therapy to assist with communication, occupational therapy to help with daily living skills, and behavior therapy to manage behavioral issues. Anti-seizure medications are used to control seizures, and sleep aids may be prescribed for sleep disturbances. Early intervention and consistent support are crucial for maximizing the individual's potential. Since Angelman syndrome is usually caused by a spontaneous genetic mutation, there's currently no way to prevent it. Genetic counseling may be beneficial for families who have a child with Angelman syndrome, especially if the condition is caused by a UBE3A mutation or uniparental disomy, as there's a slightly increased risk of recurrence in future pregnancies. However, for most families, the risk of having another child with Angelman syndrome is very low. Angelman syndrome is a lifelong condition, and the prognosis varies depending on the severity of the symptoms. With appropriate support and management, individuals with Angelman syndrome can lead fulfilling lives. They typically achieve developmental milestones at a slower pace than their peers and may require ongoing support throughout their lives. Recent research is focused on developing therapies that target the underlying genetic cause of the syndrome. This includes gene therapy approaches aimed at activating the paternal copy of the UBE3A gene, which is normally silenced in the brain. These emerging therapies hold promise for potentially improving the neurological function of individuals with Angelman syndrome and represent an exciting area of ongoing research.